So, I'm sorry, naputol yung first part. Idudugtong na lang natin. There was a problem with my application. Siguro sobrang haba na. So, this is a continuation or part 2 of our physical assessment lecture. So, part 3 na yung ating demonstration. So, in performing the Weber's test, nasabi ko na kanina yung normal findings. So, kapag sound is heard better in impaired ear, so that is indicating a bone conductive hearing loss. Okay? Probably due to obstruction. Or the sound is heard better in ear without a problem. That might also indicate a sensorineural disturbance. So you have to note findings as Weber positive, okay, and indicate whether it is right or left ear, okay. So let us move on to Rinne's test. So another test of the ear, hearing, no. Okay, this is how it is done. So, meron din ito sa video ko. So, this picture is the position A, and then, position B, doon sa mastoid. Okay? You can use a tuning fork test. Okay? So, yun yung technique. Ito pala yung sa Weber's test. Yung kanina is the Rinne's test. Okay? So, this is how you will do that. So, ang difference ng Weber's test and the Rinne's test. Okay. So, conduct the Rinne's test to compare air conduction to bone conduction. Okay. So, ito yung sasabihin natin, yung itatap mo yung tuning fork doon sa nemo or any bony areas, and then you ask the client, should be perpendicular dito sa ear, at sasabihin mo, this is the position A. Kung may naririnig kayo, pag wala na kayong naririnig, sabihin nyo po sa akin, pag wala na, then pag wala na siyang narinig, you have to move it at the back, yung sa mastoid area or mastoid bone. And then, sasabihin ni patient kung saan mas malakas. Okay? The normal findings is that the air conducted or AC hearing is greater than bone conducted or BC hearing. Yun yung dapat mas malakas yung air, no? It means that is normal or positive Rinne's test. Okay? So, deviation from normal. The bone conduction time is equal or longer than the air conduction time. So, inoorasan mo rin yun. Kung ilang minutes, kung pinakinggan dito, ilang minutes din dito. Sa anong mas mahaba, ano yung mas matagal na mas naririnig niya, na mas malakas. Okay, that indicates a negative Rinne's test or indicates a conducted or conductive hearing loss. So, there are types of hearing loss, no? The conduction hearing loss, which means, it is the result of interrupted transmission of sound waves through the outer and the middle ear structures. While the sensorineural hearing loss, it is the result of damage to the inner ear, the auditory nerve, or the hearing center of the brain. So, kapag sensorineural hearing loss. Okay, so anong ginagamit natin sa sensorineural, sa conduction hearing loss? So, ito yung ginagamit natin sa conduction, yung Rinne's test, sensorineural, yung ating Weber's test. So, mixed hearing loss, it's a combination of conduction and sensory neural loss. So, finally, we're done with the ear. So, let us now move on to the assessment of the nose. Okay? So, gising pa ba kayo? Inaantok na. Okay? For the nose, you have to inspect the external nose for any deviations in shape, size or color, and flaring or discharge from the nares. Okay, the normal findings should be symmetric and straight. There should be no discharge or no flaring. Kasi kapag may flaring yan, parang hirap siyang huminga. Hindi makapasok ang air. Diba? So, uniform dapat yung color, of course. Deviation from normal, it is asymmetric. There is a discharges from nares. May sipon siguro. There is a localized areas of redness or presence of skin lesions. And lightly palpate the external nose. Okay, external nose. Palpate mo yan. And then, that is for you to determine the areas of tenderness or pain, masses, and displacement. So, normal findings, there should be no tenderness, there should be no lesions. So, abnormal findings, so there is tenderness or pain upon palpation, and there is presence of lesions. Also, determine the patency of both nasal cavities. How will you do that? You can ask the client to close the mouth, exert pressure on one nares, and breathe through the opposite nares. So, hinga siya. Repeat on the opposite nares. Okay? Ayan. So, normal findings, the air moves freely as the client breathes through the nares. And deviation from normal, so the air movement is restricted in one or both nares. So, hirap merong obstruction probably. Inspect the nasal cavities, no? Meron siyang nasal scoop. Yan. Pero tayo, we will use again the pen light. Okay? Inspect the nasal cavities. The normal finding should be mucosa is pink. If there is any discharge, should be clear and watery. There should be no lesions. The nasal septum is intact and in the midline. So, deviations from normal, the mucosa is red, edematous. There is an abnormal discharge, example, porulin or may sipon. Presence of lesions, example, polyps. Septum is deviated to one side. So, palpate the facial sinuses. So, ito yung frontal, no? Frontal sinuses, sphenoid sinuses, ethmoid, and then the maxillary sinuses. Pero, ang pag-check daw ng frontal sinuses, kung merong pain yan, so dito siya, hindi dito. Kahit nandito siya sa top, so you press it from here. Okay? And then, palpate the sinuses. So, yan yung pinapalpate mo yung mga sinuses na yun. So, palpate the maxillary and frontal sinuses for tenderness. It should be not tender. If there is tenderness in one or more sinuses, that could be deviation from normal or that is abnormal. Illuminate the frontal sinuses by placing a pen light against the inner aspect of the supraorbital ridge of the frontal bone. It is best done in a darkened room. So, the normal finding is that the sinuses are well outlined. It contain air and light up equally. So, walang obstruction. The fluid is in sinuses appears darker on transillumination when there is an abnormality. Okay, transilluminate the maxillary sinuses. Place a pen light in the mouth and shine it to the left and to the right. Okay. So, I don't think nagawa ko rin ito doon sa ating demonstration, no? So, pen light ka doon sa mouth. Yan, left and right. So, as above. So, yung findings mo rin, katulad lang din ito. So, outline, yan, contain air and light up equally. Okay, so we're done with the nose. Let us now proceed to the mouth and the pharynx. Okay, so ito yung mga teeth, ayan, tonsils, soft palate, para at least alam ninyo, uvula or uvula. So, ayan yung mga teeth. Pinakita ko lang yan para may idea kayo. Okay? So, inspect the outer lips for symmetry of contour, color, and texture. So, the normal finding is that it is uniform pink color. So, darker, example, bluish, who in Mediterranean groups. And in dark-skinned clients, it is soft, moist, smooth, and smooth ang kanyang texture. Symmetry of contour, and ability to porous lips. Okay. Okay. So, deviations from normal, pallor or cyanotic ang client. Okay? Okay. So, may blisters or generalized localized swelling, may fissures, crust, or scales, may be a result from excessive moisture or nutritional deficiency or fluid deficit. Kaya ganon, may mga blisters. Or inability to purse lips, that could be an indicative of facial nerve damage. Okay? So, paano mo ba ipapapurse ng lips ang iyong client? So, pwedeng, or, okay. Bumalik tayo doon. So, mouth and pharynx. Inspect and palpate the inner lips and buccal mucosa. Okay, you can ask the client to say, Inspect and palpate the inner lips, diba? And buccal mucosa for color. Check for moisture, texture, and the presence of lesions. So, the normal finding should be uniform pink in color. Prickle-bound pigmentation in dark-skinned clients. Normal lang yon. It is moist, smooth, soft, glistening, and elastic texture. So, drier oral mucosa in elderly could be due to decreased salivation. So, yung deviations from normal, may pallor or white patches or leukoplakia. So, there is an excessive dryness or mucosal cyst irritations from dentures, or there is an abrasions, ulcerations, or nodules. Those are abnormal findings. Okay. So, for the mouth and pharynx, okay, inspect the teeth and gums. This can be done while examining the inner lips and buccal mucosa. So, dapat isang lang yun. Tapos, sasabihin nyo na lahat ng findings. Doon sa aking demonstration, inisa-isa ko siya para per step, maintindihan ninyo. But in actual, isahang nga lang ng pasyente yan habang tinitingnan mo yung inner lips niya, tinitingnan mo yung mga sides, tinitingnan mo yung uvula, tonsils, ngipin. Isahan lang dapat, hindi na yung paulit-ulit. Okay, the normal findings, there are 32 adult teeth kapag kompleto. It is smooth, white, shiny, tooth enamel. So, the gums is pink. It could be bluish or merong dark patches in dark-skinned clients. It is moist, firm texture to gums. There is no retractions of gums or pulling away from the teeth. So, deviation from normals, there are 2 missing teeth or ill-fitting dentures. It is brown or black, or there is brown or black discoloration of the enamel that may indicate a staining or a presence of caries or dental caries. Okay? There is excessively gum or red gums or may possibility of bleeding. Spongy texture, bleeding, or tenderness may indicate periodontal disease. There is receding atrophied gums. There is swelling that partly covers the teeth. Okay. So, inspect the dentures. You can ask the client to remove complete or partial dentures. Inspect their condition by noting the broken or worn areas. Okay, the normal findings. It is smooth and intact dentures. Okay, deviation from normals. Possibly there is ill-fitting dentures. It is irritated, or there is an excoriated areas under the dentures. Inspect the surface of the tongue. Okay, the position. Okay, the color and the texture. Okay, the tongue should be in the central position. Nasa gitna naman talaga yan. It is pink in color. Some brown pigmentation on tongue borders in dark-skinned clients is normal. It is moist, slightly rough, thin whitish coating lang, maninipis lang. It is smooth, merong lateral margins, and there is no lesions. So, may deviations kapag it is deviated from the center. So, maybe there is, or it indicates damage to the hypoglossal or 12 cranial nerve. So, yung smooth red tongue may indicate problem, vitamin deficiency, no? It is dry, furry tongue, could be associated with fluid deficit. So, may dehydration. Nodes, ulcerations, discolorations, white or red areas, or there is an areas of tenderness. Inspect the tongue movement. Okay. Move niya ba? Moves freely and there is no tenderness. There is no restricted movement. Kaya sabi mo sa patient, labas ang dila. Ayan, namumove niya naman. Taas po ang dila. Titignan mo naman yung floor of the mouth. Inspect the base of the tongue, the mouth floor, and the frenulum. Ask the client to place the tip of the tongue against the roof of the mouth. Yan. Normal findings is smooth tongue, base with prominent veins. There is varicosities or tiny bluish black or purple swollen areas in elderly people is normal. So, deviations, pag merong swelling, merong ulcerations. Palpate the tongue and floor of the mouth for nodules. So, papasok mo talaga yung kamay mo. Hawakan mo talaga. Lumps or excoriated area. You can use gauze to grasp tip of the tongue. So, the normal finding is that it is smooth with no palpable nodules. Say, ang ilalim. Deviations from normal, there is swelling and nodules. Okay, abnormality of the tongue, split tongue, red tongue. Yan. So, tongue tie. Yan. Macroglossia. Ito yung tongue tie. Yan, tongue tie. Macroglossia or black hairy tongue or geography. Yan. Mga abnormalities of the tongues. Inspect salivary duct openings for any swelling or redness. Okay, it should be same as color as buccal mucosa and floor of the mouth. Deviation, there is an inflammation or there is redness or swelling. That's abnormal. Inspect the hard palate and soft palate for color, shape, texture, and the presence of bony prominences. So, the normal findings is that it is light pink. Smooth, soft palate. Lighter pink, yung hard palate, and it is more irregular in texture. So, deviations, there is discoloration, example, jaundice or pallor. Plated, same color. Irritations, meron, may bony growths or exostosis. There is a growing from the hard palate. Inspect the uvula for position and mobility while examining the palates. Diba kanina? Tinitingnan mo na yung mga palates. So, position in the midline or soft palate, yung uvula. It vibrates, no, when the client is talking. So, deviation from normal, it is deviated to one side, probably because of trauma or tumor. Immobility may indicate damage to trigeminal or fifth nerve or vagus or the 10th cranial nerve. Okay, possible may problem kapag may immobility. Inspect the oropharynx for color and textures. The oropharynx, it should be pink and smooth posterior wall. So, kapag may reddened or edematous or there is presence of lesions, plaques, or exudates, that is again abnormal. Inspect the tonsils for color, discharge, and size. So, the tonsil should be pink and smooth. There should be no discharge and it should be on normal size. So if it is inflamed, there is the presence of discharge, or it is swollen, that could be a sign of tonsillitis. Okay, inspecting the tonsils for tonsillitis. Yan. Illicit gag reflex. So is it present pag pinasok mo yung kamay mo? If it is absent, may indicate problems with glossopharyngeal or your vagus nerve or your cranial nerve number 10. So we're done with our mouth and tongue. So we'll proceed to the assessment of the neck. So in the assessment of the neck, inspect the neck muscle. So tingnan mo muna yan, yung sternocleidomastoid and trapezius for abnormal swelling or masses. Pwede mong pataas yung head ni client. Yan. So, the muscles is equal in size and the head is located at the center. So, deviations from normal, there is a unilateral neck swelling or the head tilted to one side that could indicate presence of masses, injury, muscle or muscle weakness, shortening of sternocleidomastoid muscle, or there is a scars. Yan. Sternocleidomastoid muscle. Okay, observe the head movement. Okay, ask the client to move chin to the chest. Okay, move the head back so that the chin points upward. Move the head so that the ear is moved towards the shoulder on each side. Okay, right and left. Okay, so you ask the client to move the chin to the chest. Okay, head back so that the chest points, and then side. So the movement is coordinated, smooth movements with no discomfort. So the clients, okay, deviation from normal, there is a muscle tremor, spasm, or stiffness. There is limited range of motion, hindi niya maigalaw, may masakit. Okay, painful movements. Merong involuntary movement, example in up and down, yan, nodding movement associated with Parkinson's disease. So assess muscle strength. So turn the head to one side. So habang hinahawakan mo yan, like in the picture, one side, shrug the shoulder against the resistance of the hand. So there is an equal strength. So dapat pareho. Abnormal kapag may unequal strength. Okay, you need to memorize the following nodes, no? Location: submental, submaxillary, parotid, preauricular, posterior auricular, tapos papunta dito. So, kakapain nyo yan occipital, tonsillar, supraclavicular, posterior cervical, and the deep anterior cervical dito sa malapit. Okay? So, nasa aking demo rin yan. Okay? Palpate the entire neck for enlargement of lymph nodes. So, it should, the result should be not palpable. Deviations from normal, baka may enlargement kang nakapa, may palpable, possibly tender, could be associated with infection and tumor. Okay? Palpate the trachea for deviation. So, is it deviated to the other side? So, palpate the trachea for lateral deviation. So, the normal findings is that the trachea is located at the central part of the neck, or it is in the midline. So, spaces are equal on both sides. So, deviations, kapag it is deviated to one side, that indicates a possible neck tumor. So, or there is an thyroid enlargement, or there is an enlarged lymph nodes. Kapag deviated yung trachea, it should be located at the center. Okay? And then, inspect the thyroid gland. So, pwedeng sa harap mo siyang hawakan or at the back. So, the normal findings is that it is not visible, no, on inspection. So, if it is visible, diffuses, or there is a local enlargement. So, palpate the thyroid gland for smoothness. So, yan, may approach na sa harap or may approach na nasa back. So, ang ginawa ko is the posterior approach, no? Posterior approach, but you can do that also anterior approach. And then palpate the thyroid gland for smoothness, okay? The lobes may not be palpated, or if palpated, lobes are small, smooth, centrally located, painless, and it dries freely with swallowing. So that's your normal findings. If there is a deviations, so there is solitary nodules. So for the neck, if enlargement of the gland is suspected, auscultate over the thyroid area for brewy sounds. You have to observe it. What is brewy sounds? Brewy sounds is like shh, shh, yan, swishing sounds. Abnormalities of the thyroid and parotid glands. So, ganun ang mga itsura. So, may enlargement of the neck. Actually, we're done with the physical assessment 1. So, in my return demonstration, so in a step-by-step ko yun, but then, when you perform it, na kayo na ang gagawa, hindi mo na kailangang, yes, you need to follow the step, pero each step, result na kaagad or normal findings na kaagad ang sasabihin nyo. At kapag nandun kayo sa part naman ng mouth, isang lang na patient, look at na lahat. Ang kailangan mong tingnan mo na yung uvula, tingnan mo na yung tonsils, the soft palate, hard palate, tingnan mo na yung tongue, tingnan mo na yung teeth. So, lahat na yun parang, hindi yung ganun. Okay? So, let me end my presentation or discussion with these quotes from Nurse's Lab. So, nurse is just another word to describe a person strong enough to tolerate everything and soft enough to understand everyone. Okay? God bless everyone.